Hello, I'm Ian Sadler from Norfolk's BX Clinic, and today we're just going to talk a little bit about heel pain and more specifically who's getting heel pain, how long it's likely to last. So probably 1 in 10 adults will suffer some form of heel pain, usually called plantar fasciitis, in your adult life. So it's quite a big problem, and it really is described very often as hell and depressing and really agonising pain. So for those suffering with heel pain, we want to sort of talk about how long you might be suffering with it and then when to do which types of intervention. So if we imagine that we have 100 people suffering heel pain, so nearer there, 100 on that side. So the first proportion of people suffering heel pain, 40% of people, just have a problem with their heel. They've injured the tissue of their heel somehow, so the plantar fascia or some other structure around the heel has just become injured by an activity or a twist or a turn or something you did. So that should, in and of itself, get better in about 6 weeks, all right? So you should be better in about 6 weeks, just from recovery, rest, ice, those sorts of normal standard things. So if you're not better in that sort of time, then you'll probably need some degree of intervention. Okay, so we then have the next significant proportion of people who just need some simple stretches, exercises, some rehab to get that heel pain better. So if you're one of those people, from the point of admitting you have a heel pain, because a lot of the time you probably put up with it for a couple of weeks before you actually start trying to do things about it. So by the time you've admitted a heel pain, we're looking at about 6 weeks to here, and then doing the rehab maybe takes another 4 weeks or so. So we're looking at 10 to 12 weeks to be good, healed in that sort of time. All right. So the next thing we need to, if that heel pain keeps coming back, if it gets better then worse again, if it just won't go away, if it starts moving around in your foot, then we are going to have a look at why you're getting that heel pain. So something is putting a stress on your heel that won't let you heal it, won't let you get better from it. So this is where we come in, and we're dealing with almost all of the rest of those people. So a podiatrist is going to have a look at how your foot's put together, how the structures are being strained by your activity, by the ground, by the way your foot works, by the way your leg is making your foot work. So we're going to have a look at all of those. And then the final amount of people, we need a bit of extra help, and we might need to send you for a scan or something like that. But again, we'd be looking at managing that for you. So if you are suffering with heel pain, please do get in touch with us. But otherwise, thanks very much. I hope that was useful.